Greetings. Look at the picture above. Uh, the picture above, you can see babyrex, bonababe, and paracetamol syrups, right? And nursing mothers use these drugs for their babies a lot. They use it for when the baby is running temperature, when the baby is having colic, even though I don't believe in the concept of colic. When the baby is having colic, right? They use it. Or abdominal discomfort, they use it, they give the baby. But it has come to my notice that most of you women and even parents, you don't know, you combine these drugs. I've seen a woman combining bonababe and paracetamol syrup. I've even seen a woman combining babyrex and bonababe. And that means you are actually overdosing your baby. That's what it means. And it is a wrong practice. Before you do this, before I proceed, you need to know what each of these drugs contain. Paracetamol is paracetamol syrup, right? Paracetamol syrup is paracetamol syrup. It contains paracetamol only, right? It does not make the baby drowsy. It does not contain any other drug that will make the baby sleepy or drowsy. You see bonababe. Bonababe contains paracetamol and chlorpheniramine, right? That chlorpheniramine will make the baby drowsy. It's what makes, so you notice that when you give your baby, it will make the baby drowsy. It will help stop pain and also make the baby sleepy, drowsy, right? Baby rest also contains paracetamol and chlorpheniramine. So when you give the baby, it makes the baby stop pain and makes the baby drowsy. So one thing I forgot to tell you is that these drugs are also used for teething problem. Mothers give it to treat babies that are having teething problem, right? It helps stop the pain and also the temperature that comes with teething. So they believe. Now, the reason I'm doing this video is to let you know that you are doing it wrongly. You are giving your baby too much of these drugs. Bonababe is a different brand from babyrex. They both contain the same drug, paracetamol and chlorpheniramine. They both contain the same drug, but it is surprising that most of you don't know. Some of you will now take some drops of bonababe, some drops of chlorpheniramine, and be giving the baby. You are overdosing the baby. Hope you know that paracetamol overdose, right, can damage a baby's liver, can damage the baby's liver. You are not supposed to combine any of this. It's either you are giving paracetamol and giving paracetamol alone, or you are giving babyrex and giving babyrex alone, or you are giving bonababe and giving bonababe alone. Don't combine the two, because the three or the two, because they contain the same thing. Apart from paracetamol syrup that is on its own, paracetamol alone, bonababe contains paracetamol and chlorpheniramine. Babyrex contains paracetamol and chlorpheniramine. So you understand what I mean. So if you have been doing this, you better stop, because you have been doing it wrongly, right? You have been doing it wrongly. You understand? Stick to one of these drugs. As you can see, they stick to one and give one. Don't combine the two, or combine the three. Thank you, bye-bye.